Votes in favor of Dr. Camilo Aline, 16. Votes in favor of Dr. Yarvas Barbosa Silva Jr., 21. So
the man on the front lines of the regional public health response over the last 2 years is now tapped to take the top spot as director of the Pan American Health Organization when current head Dr. Carisa Etienne demits office next year. Brazil's Dr. Barbosa da Silva Jr., as PAHO's assistant director, piloted the organization's efforts to increase access to COVID-19 vaccines and to improve the region's ability to supply medicines and other health technologies. Da Silva is a graduate of Brazil's education system, becoming a certified physician at the Federal University of Pernambuco and receiving specialized training in public health and epidemiology at the National School of Public Health in Rio de Janeiro. Da Silva completed his studies in Sao Paulo at the University of Campinas and now possesses a master's degree in medical sciences and a PhD in public health. Dr. Barbosa has a long career in the field of public health, having served as the Secretary of State of Health in Pernambuco, the Municipal Secretary of Health of Olinda, and the Director of the National Center for Epidemiology in his home country. He joined PAHO's team in 2007 as Area Manager for Health Surveillance and Disease Management, where he organized regional observation, prevention, and control actions for communicable and non-communicable diseases. He also performed the same tasks for veterinary public health, health analysis, and statistics. Dr. Barbosa returned to the Brazilian Ministry of Health in 2011, serving in various capacities, including Director-President of the country's health regulatory agency, before returning to PAHO as Assistant Director. On Wednesday, after the vote that cemented him as the agency's next director, Barbosa emphasized his commitment to continuing the work of his predecessor, Dr. Carisa Etienne, with the support of the region.
It's not easy to follow Dr. Etienne's leadership, but I do believe that with the same commitment that we have to strengthen health, to strengthen the quality of life, and in our vision, we work together.
He completed the rest of his address in Spanish, saying it was an honor to have been selected to represent the organization.
I am very proud as a public healthcare worker. I think that any public health worker would be proud to lead an organization that is 120 years old. So my commitment is to continue to uphold the same values that we have always defended: solidarity, the desire to have all countries working together in coordination so as to improve the quality of life and the health in the region.
The election was conducted on Wednesday via secret ballot, with 4 rounds of voting being necessary before Brazil's candidate beat out Dr. Camilo Aline from Panama, Dr. Nadine Flora Gassman Zilberman from Mexico, Dr. Florence Duperval Guillaume of Haiti, and Uruguay's Dr. Daniel Salinas. Dr. Barbosa's first term in office will run from February 2023 to January 2028. He will then be eligible for re-election, but will be term limited after that.